And this is going to be something that the Supreme Court for many generations is going to be known for. They are excising one of the provisions regarding Medicaid expansion that would allow the federal government to punish states if they don't agree to doing things certain ways. But that's unclear because the language is ambiguous. But the rest of the law has been upheld in great part because the majority, which included Chief Justice Roberts, who wrote the opinion, deemed the mandate a tax under the Article I taxation privileges of the Congress. The administration talked about making it a tax originally, but politically that was inviable. It wouldn't have even passed the Senate at the time. But by interpreting it as a tax in fact, what they've done is they've said it's no longer a mandate issue, and Congress does have the authority to require you to do something, to pay a tax. It means that all Floridians can have a safety net now that's real. Somebody's going to have to pay for it, and somebody's going to have to administer it, but it's real. It also means that because the mandate was enacted, that the large insurance companies are not going to forsake the health insurance business. They'll be able to help pay for the offset of costs. And that means that we won't have to worry about creating an alternative public sector program, though the exchanges are designed to do just that. It means several things for Florida. One, it means that with respect to Medicaid, the legislature is going to have to come up with additional funds to support the Medicaid expansion so that more people will be coverable under Medicaid. Not necessarily in full, because the premiums will have to be paid in part by individuals if they can afford it based on their income. It means that Floridians won't have to worry any longer about their 18 to 26-year-old children and if they'll be eligible to be on their plans. It means that elderly Floridians within 2 years are not going to have to worry about their Medicare prescription drug benefits choking them off after they've started paying for them, that donut hole is going to be closed, and that the legislation that was pushed by the pharmaceutical companies is going to be eliminated. Because reform doesn't come with litigation and legislation alone. It's going to come with cultural changes in the way we practice medicine, which is how we're doing things at our medical school. We're changing the way we train physicians to practice medicine, but it's also going to be with respect to our expectations as patients and consumers. We pay too much for pharmaceuticals, we dispense too many pharmaceuticals. We pay too much for ancillary and diagnostic tests, we prescribe too many ancillary and diagnostic tests, and we do too many services and procedures in hospitals. And when you look at the outcomes of all the things that we do and all the money that we spent, I can say it again, we suck compared to the rest of the United States, compared to the rest of the world. We get fewer and lesser bangs for the buck than any other industrialized country on earth for what we spend on health care. If you get shot in the chest or hit by a truck, this is the best place in the world to come for care. But God forbid you should require preventive services, public health services, or if you have a chronic disease, it is the worst place to be because we focus on expensive testing, pharmaceuticals, and expensive interventions because we can't see the long haul. We're very short-sighted. I'm not sure that this law alone is going to change that, except that it does have language in it that will encourage payment for value as opposed to payment for services. And that's where we have to go. That value is going to reside in the outcomes, in being able to say, as a consequence of caring for you, you got better.